So I'll just start recording.
Thank you, Amy. So let's, Amy, move to the agenda. Hi, Gail. So this is what the agenda will look like. I'm not going to read through that, but we'll definitely talk about next steps at the end. So have your thinking caps on and think about the kinds of things that you might want to do going forward with social media. And our learning objectives, Amy.
Mhm.
So by the end of the session, we hope that you'll be able to identify 2 benefits and challenges. You can probably do that now of using social media to share health information, that you'll be able to define, recognize, and respond to health information and disinformation with social media content. And finally, that you'll understand the importance of checking one's employer policies on the use of social media on the job. So welcome, and I will turn it over to you, Amy.
Great. So Gail, she's already introduced myself and Gail B, who is also on the meeting now. Hi, Gail. But just to get us started for today, I wanted to just set some baseline understanding of where we all are with social media. So I'm going to start a poll just to understand what you guys use with regards to social media and how often we use it. All right, I'm just gonna close out the poll for now. See what you all said. I think everyone should be able to see the results now. Lots of Facebook, Instagram, LinkedIn also, some Twitter, some TikTok. We can also think of some messaging apps like WhatsApp, if any of y'all are familiar with that, as social media as well. And then in terms of how often we use social media, looks like almost everybody says they use it every day. So it is a big part of all of our lives, or at least most of our lives. Great. And then next, let's think about social media with regards to health and our roles as folks either who are working as CHWs or supporting CHWs in public health. So let me launch now this poll. Oh, let me go back to there, launch. All right, I'm just going to close the poll for now and let's see. So it looks like most folks don't really use social media as part of their role as a CHW or otherwise to advocate for health information. And it also looks like not many people have heard about quote unquote the infodemic either. So hopefully that will change by the end of the session this morning. Great. Well, with that in mind, Gail B, as Gail McRae introduced earlier today, will start us off with some information about the infodemic and health misinformation, as well as how to approach social media and thinking about narratives and how to respond to those online. So Gail B, do you want to get started? And let me know also if you want to share the slides yourself. Otherwise, I'm happy to click through them here.
Thank you, Amy. Yeah, if you don't mind driving, that would be great. I'm not the best multitasker in that area. But hello, everyone. Good morning. I like to call myself an advertising refugee. My background is in corporate communications, as well as social and impact and cause marketing. But as of 2020, I made the choice to bring everything that I guess I had accumulated and knowledge, skills, interests, all of that in that space into the public health space. And in particular, addressing COVID-19, COVID vaccine hesitancy, and now we're expanding into other areas of health equity and social disparities. So let's jump into the Black Cross. Next slide, please. Okay, great, thank you. So we like to say where the Red Cross meets the Black Church meets the block. You know, we're a group of scientists, I guess, subject matter experts, storytellers, and most prominently in myself, cultural strategists. And we work to advance health equity in particular communities of color. We lean into methods that are rooted in community-based participation and the art and science of conversation and storytelling. And so we'll get into that as part of kind of the storytelling for social change. Our core capabilities really lie in community listening and social listening being natural language processing, using AI to actually analyze conversations in the social media space, storytelling for change, which is why you're here today, I'm imagining. We produce ambassador, advocacy, ally, and community health worker tools and training. And then we do campaign amplification through our Alive in Color platforms. And we'll talk about that if we have time at the end. A couple of collaborations that we've engaged in toward healthy change since 2020. I mentioned the community and social listening. So actually in 2020, we did some natural language processing or social listening through the Twitter fire hose. And for those who may not know what that means, it's pretty much all of the information that gets posted to Twitter via a tweet across a particular period of time. So we analyzed conversation in Fulton County, followed changes in mental health, really, or I guess the affect that's displayed online as it relates to mental health. We also conducted surveys and listening sessions with community advocates. We did a pretty robust project with the Center for Global Health Innovation in partnership with Morehouse School of Medicine and the Prevention Research Center, Johns Hopkins University, Emory University, where we developed a proprietary approach called the counter-narrative approach to storytelling in social media and through conversation. And that's really the core of what we'll get into today. I know we said social media 101, and we are going to kind of give you some baseline understanding of social media, the pros and the cons, I guess. And then we'll get a little bit deeper into actually how to create content that leverages storytelling methods to drive that social change or drive that behavior change in a particular community. All right, we will be circulating, to my knowledge, I think Amy, right, the presentation after the training. Great, okay, so you guys can lean into anything that I haven't covered, and of course, follow up with me directly if you have any questions. In sum, you know, across the course of, let's say, July 1st, 2021 through April 1st, 2022, we trained about 1,200 people, upwards of 1,200 people. We had about 1,700 or upwards of 1,750 conversations regarding COVID-19 and the COVID vaccination. And we distributed materials, training materials, literature, tip sheets, the whole nine, to about almost 11,000 people across that period of time. So we have gotten a little bit of mileage during the time that we've been here. Okay, so next slide. Let's get into how we create conversations and content that drive vaccine confidence and uptake. And this is pretty much the bulk of the presentation. But before we get into the the really nitty gritty of that part of it, we're going to talk a little bit about social vulnerability and why it's really important to expand the definition, or the traditional definition of social vulnerability, into the social media space. Next slide. So social vulnerability in the new social square is a lot that I talk about. Next slide. Really, we talk about the fact that, health disparities and social inequities continue to plague communities of color, which that's no new news to you. That's why you guys have signed up to be community health workers. We've got some pretty compelling stats as it relates to the health inequities, but also the disparities in the social determinants of health, of course, as it relates to these communities, particularly African-American communities, as it relates today. Next slide. But the good news is that there's a growing movement of young people and people of color, and particularly African Americans, who are turning to social media to actually drive social change. And we have been able to quantify that activity. We know that this activism online actually does influence public opinion. We also know that actions at a national level in mass, such as around the George Floyd death, Ahmaud Arbery, those actions actually did have a direct correlation with policy actions that were taken at the local level. This is the new frontier, right? So I've been saying probably for about 15 years, dating myself, and I've been in the game longer than that. But I've been saying that cultural wars are really waged. They're won and lost in the social media space. And as it relates to health equity, unfortunately, we are engaging in a bit of a cultural war, and we'll talk a little bit about what that means. Next slide. So just a few of my favorites, some of these amazing young adults, young people, and not so young people, maybe in their 30s, almost 40s, who are constantly making content to debunk, demystify, educate, and enlighten people of color online. Some of you might be familiar with Joel Burville. He's a medical student who has, I think, upwards of 100 and some odd thousand followers on Instagram alone. He's been invited to the White House. And he is well known for creating content specifically targeting African Americans, educating and enlightening them on health disparities as well as the inequities. Dr. Darian, you may know, he has actually started making a lot more of the rounds on television, but during the pandemic, he produced a ton of content that was targeted directly at false narratives or false stories as it relates to COVID-19 or the COVID vaccine. Next slide. Next slide. Okay, cool. So misinformation and disinformation. This is really at the crux of the infodemic, right? And misinformation and disinformation have expanded this notion of social vulnerability in the social square. Why is that? Well, first, let's level set on misinfo versus disinfo. Misinformation is that information that is unintentionally spread, and it tends to confuse or harm the audience, right? Unintentionally. Disinformation is information, incorrect information, that is spread for an agenda. There's some strategy behind it. And it's usually disseminated to mislead, confuse, influence, harm, demobilize, in the case of voter protections, a specific audience. And really, the challenge is such a threat now. We're not just combating people who are creating posts that are false and targeting them to vulnerable communities. We're combating automated technology in the form of bots, ChatGPT. That technology that underlines that functionality is actually part of what helps to create mass content to be disseminated as disinformation. We have seen, studies have shown that disinformation is disproportionately targeted towards communities of color, largely because they're vulnerable due to their high levels of mistrust and distrust. And we know that this disinformation stokes these longstanding fears, right, and distrust that were already there in these communities of color. So really very dangerous as it relates to health. Next slide. So when we think about kind of the impact of these targeted campaigns, we also have to account for the fact, or just the dynamics of truth versus falsehood, right? They always say, some people say good news travels fast, bad news travels faster, right? Well, that is what we should be aware of as it relates to mis and disinformation. Studies have shown that false news is 70% more likely to be retweeted or shared in Instagram or on Facebook, and 10 to 20 times faster in reaching at least 1,500 people. They call that a cascade, right? So I have this visual here just because a friend of mine's child came home one time after school and said, mommy, did you know that rain falls X times faster than snow? And so I kind of like to just use that as a metaphor for people to really understand that truth is falling very slowly and gently like snow. But that falsehood or that mis and disinformation really falls like the monsoon, the rains that we've been seeing in the Atlanta area recently. Next slide. Now, there are the good people like ourselves who are out there using social media to spread this information, right? To correct mis and disinformation. But unfortunately, that information is often what we call shadow banned. Shadow banned, and I use that word liberally, it's usually an effort of a platform to limit the spread of mis and disinformation by kind of limiting the exposure that a particular account gets in other people's feeds, right? But because of the nature of the algorithms that favor sensational headlines, novel information, all these things, they tend to prioritize mis and disinformation based on how it's presented and bury all of the real news and the good news and the true information. And so how do we get around that? So that's part of our agenda, part of why you're here, and part of why we're going to bother you after this training to help us solve that challenge. Next slide. The filter bubble. I called that out. You might have seen it on the previous slide in terms of the book that has been written about the filter bubble, but it really is important to understand. And before I actually go further, how many of you have heard of the filter bubble? If you could just maybe raise your hand, or either virtually, thank you, Frank, exactly, or via icon. Great. Okay, so we have some people who have heard, but I see that most of you, and thank you for being forthcoming, because obviously it's not a common word, but the filter bubble is something, it's a term that we've coined to talk about how algorithms will keep us locked in what we call, next slide, Amy, I'm sorry, a sea of sameness. And what that means is that algorithms in their agenda is personalization, right? Their goal is to get information that is going to be as relevant as possible to you in as timely a fashion as possible, right? And so what they do is they learn you, they learn your preferences, they learn what information you've liked, what have you shared, what have you downloaded, and then they go even further and they look at your friends and your social network. They call that the social graph. So they look at all the people that are connected to you. What have they liked? What have they shared? Well, we know that we tend to form networks with people who have similar preferences or similar ideas and concepts. And so the next thing we know, we're sharing the same information within this bubble or small community of individuals, right? Without actually getting exposed to the real information. Next slide. I'm not going to play this because I think I'm running a little bit low on time, but this is a video we created to educate communities about the filter bubble. And it will actually be showing in the American Public Health Association's online film festival in November. So if you are attending that or checking that film festival out, look for us and please do take a look at the video, because I do think it breaks it down in a very simple and accessible way. Next slide. And finally, we have arrived, the infodemic. So everything that I have discussed with you thus far, it kind of all adds up to the infodemic. Infodemic is a term that was coined to describe the overabundance of information on the novel virus and vaccine during the pandemic, right? Some of that information was accurate, a lot of it was not. And due to the nature of the virus being novel, well, of course, we know how science works, right? It changes as we learn more. So all of this added up to what we call the infodemic, making it really hard for people to get the information they need when they need it. It coupled with kind of this, strategic targeting of disinformation, it really left these information gaps in distrustful communities of color to kind of create their own narratives, right? So we saw a lot of stories going around about conspiracy theories, maybe the government being in collusion with big pharma or whatever it might be, things that are actually reasonable when you look at the histories of these communities, but nonetheless weren't necessarily true, right? So I'm going to turn this over to Amy for a bit, who's going to give you a little bit more detail on the infodemic and its impact on vaccine hesitancy. And then we'll come back to kind of combating the infodemic.
Great. I was just going to share a little bit of information about how the infodemic truly has impacted COVID in particular, and how that in turn is also spreading beyond COVID itself as well. So I think many of us have sensed in our own lives, just from hearing what people say around us and seeing online, that there is indeed lots of COVID-19 mis and disinformation online. But research has truly shown that online misinformation has indeed been linked to measurably decreases in COVID-19 vaccination, and again, increases in vaccine hesitancy and refusal. And we've also seen beyond COVID itself that overall vaccinations, including childhood vaccinations and other routine vaccinations, have also been backsliding since the COVID pandemic. Obviously, there's a lot of factors driving this, but certainly online mis and disinformation is part of it here, where hesitancy about the COVID vaccine in turn has driven hesitation about many other vaccines in general. Again, as Gail B alluded, the social media platforms themselves are doing what they can, but unfortunately that simply just isn't enough a lot of the time. And especially when it comes to marginalized communities, it's the content that affects marginalized communities the most that often goes the least monitored and managed online, whether that's Black and Hispanic communities here, that including the communities that many of you all serve, as well as communities in the global South, and especially content that doesn't come in English, for example. So we've seen with COVID in particular that a lot of mis and disinformation online has really specifically targeted or fed into the sort of cultural narratives of, again, communities of color, and affecting folks, including the ones that we all serve and are part of in our communities and families the most. And of course, aside from the platforms who are doing, again, what they can online, it really comes down to people like CHWs who are truly on the front lines in their communities, and to some degree, all of us in our communities and families, to really address these hesitancies and speak to those that we care about COVID-19 and other things, and really get at the health and mis and disinformation. Gail B, do you want to pick it back up?
Yes, ma'am. Thank you. So let's get into how you, as just a person on the internet, can help to fight the infodemic. And then obviously there are things that you can do even further as a community health worker. But next slide, Amy, let's get into that. Is that the next slide? Let's see. Okay, yes. Okay, great. Thank you. So a couple of things we've already talked about, right, in terms of why people spread misinformation or disinformation. But there's two on this page that I really wanted you to take note of. One is it's novel, and we like to feel in the know, right? People like to feel in the know, just generally speaking. What we do know, though, is that people of color, communities of color, largely, or maybe not exclusively, but largely, because they rely on word of mouth for information, trusted information in particular, so heavily, being able to share that information is a form of currency that tends to have a higher value in these communities. So when there's information that feels like it might be true, that's interesting, seems definitely sensational, and could impact me and my community directly, I'm going to share it. And to be the first to share it, well, obviously that brings me some sort of currency. So that's a huge driver online and social media, particularly just based on the culture of social media of likes, right? This whole attention culture. And then the other thing that I wanted to just lean into is they aren't paying attention. People just aren't paying attention. They're quick to share, right? It seems like it could be true. Maybe it seems like the byline is credible. Maybe there's a logo of some news agency or something, whether it's been photoshopped or not. So they're just not paying attention. What that means is that we're all guilty. We tend to all be guilty of sharing information that's not quite true. So that's just to implicate everyone. in this war against misinformation. Next slide. Great. So 6 types of information, I think, that we wanted to call out. First being memes. You may have seen this first one during the pandemic with Jordan on the left-hand side. Colorful images created as a joke. People think they're funny, but really they're not funny at all because they can in many instances reinforce incorrect information. Or behaviors that we're really trying to encourage because they're for the greater good. The second one, misleading graphs and diagrams. Those are very dicey, I guess you could say, because they could take information from a study that actually is reputable and represent it incorrectly. So we have to be very careful about the way that we interpret the information. Malicious clippings, photos and videos that have been edited. Such as the one I just mentioned, things that have been photoshopped perhaps into a picture. And there are tools every day that emerge onto the scene that make that easier. Next slide. 3 other pieces, cherry-picked statistics, kind of similar to the bars and graphs. Again, when people are quoting studies, we have to be very careful, but I'm sure that all of you guys have heard a lot about that and been trained in that. Deceptive websites. There are a lot of sites that appear to be news sites, but are actually just fake sites, as you could say. And then out of context quotes, right? So quotes that might have been clipped, maybe it's only the second half of something that was said. Either way, if you were to have the whole context, the meaning would be different. So 6 main types of misinformation that we need to be aware of online. Now I'm going to turn this back over to Amy, who I think is going to take us through key questions for fact checking. So now that you think you've seen these 6 types of misinformation, when you come across these 6 types of mis and disinformation in social media, what do you do, right? How do I confirm whether it's true or not? Well, Amy's going to take you through a couple of slides that help me to understand that.
Great. And I'd also add, as a close cousin to things that are truly mis and disinformation and just false, there's also lots of misleading content. So people say, well, I heard that da 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 da, or like someone I know got whatever side effect. All of that might not be false per se. It might be cherry-picked anecdotes in addition to cherry-picked statistics. But I think a lot of these same things apply there as well. So some key things around fact checking, and again, just understanding what content you're seeing online. First and foremost is just understanding who created the account, if it's on social media, for example, that is sharing the information that you're spreading. Is there, or what evidence is there about what they're saying? Is it just anecdotal? Is it a study that's been peer reviewed and published and whatnot? Or is it sort of emerging information, or maybe some, I don't know, random study by who knows what? And what do other sources say, especially sources that we trust ourselves and folks in your communities also trust as well. So for a deeper dive into fact-checking mis and disinformation, Gail B has here the SIFT method, where we stop, think about the information that we're seeing, investigate it in more detail, find confirmation of the true information, and then try to trace those claims to their original content. So first is to stop, to try and exercise click restraint. If you see something that's just really emotionally grabbing, or you're like, oh my God, I need to find out more about this. This just seems absurd. Probably that might be something that's really trying to get your attention and might be mis and disinformation. Maybe y'all heard about Nicki Minaj's cousin, somebody, I don't know. She's posting something that's really trying to get y'all's attention, and it did get lots of people's attention, unfortunately. Second is to investigate the source. So once you've sort of stopped and realized like, oh, I should probably pay attention to this a little more carefully, let's try to actually investigate what is being shared. So here's somebody, we don't really know who, on Twitter sharing a link to a Cleveland Clinic study. Sounds, maybe some of y'all have heard of Cleveland Clinic, but we look at the link that is actually shared. And if we click it, we can go to newsmax.com. I believe that's a sort of notorious website for very marginal right-wing, often disinformational content. And we can see if you were to go to that link, it very well might not have much substance to it. And we can also look at, well, they're saying the Cleveland Clinic is doing a study. We can go on Cleveland Clinic's own website and see what actually they have to say on the matter. So here we have, I think this is the same information. And you can go into looking again deeper into the source. So here we can see like this is the news website perhaps that somebody is linked to, and reading in more detail for yourself. Next is to find confirmation of something that you see. So one common strategy that people posting mis and disinformation use is to take one image and take it totally out of context and say it's something else. So for example, this person somewhere on Facebook, who knows who they are, is posting online that I suppose that there is targeting by the Chinese government, perhaps, of Muslim communities by releasing COVID. And they've put out this picture of lots of people lying down on the street that looks very scary. But chances are it might not really be what we think it is. So you can do, Google has a reverse image search where you can take a picture and then look online, where is this picture actually being used and where is it perhaps actually from? And you might find that this picture has nothing to do actually with COVID indeed. Finally, we want to trace the claims to their original content. And part of this again involves looking for sources across looking for the same information across different sources and trying to again nail down sources of information that we do trust, and finding out what they actually say about it and trying to find ultimately where that information or misinformation ultimately came from. There are also lots of other news and media and civil society organizations out there fact-checking information as well, or fact-checking misinformation as well. So often some of these organizations, whether in the health space or not, will also have pre-posted to some extent information about particular bits of misinformation. Great. Gilby, back to you.
Thank you, Miss Amy. All right, so the moment you've all been waiting for. Now we start to get into the storytelling part. At least this is the part that I really get into. I like to fancy myself a storyteller in general, but social media storytelling for healthy change. I'm going to fly through this information. So again, I encourage you to please reach out if you have any additional questions, and we'll give you some resources at the end of the presentation where you can dive in even deeper. All right, next slide, Amy, please. Culture. So I like first, I don't know if there are any Dune, I'm really dating myself, but I think they might have done a remake. So Dune fans, any Dune fans? Okay, thanks, Frank. I got a nod. So I like to call culture the spice, right? It's like that special thing. It is really what gives things meaning in our lives, right? So culture is at the core of who we are, right? Our personal beliefs, our attitudes, our actions, how we identify ourselves. But when it comes to culture and communications, we have to go beyond that. We can't think of culture just as kind of this package of things that we use to relate to the world. Culture, we also have to think about as cultural equity, because when I'm communicating with a particular audience, the resonance is most important, right? And resonance and relevance, right? So relevance is really about the subject matter. And that's what I am saying relevant to them, is important. Do they care? And then resonance is, well, how is it sounding? Does it sound credible? Is it coming from a trusted source? Cultural equity is what gives us the resonance, right? It is part of what gives us the resonance. It's part of what says to the audience, this is something that you should be listening to and that you should actually take heed of. Then there's the cultural lens. And that's a product of one's kind of socio-cultural and historical context or history. It's the past and the present. And it's a unique way that a person really connects or views the world, right? Or a cultural group views the world. So yes, every individual person has their own unique way of viewing the world, But when we look at cultural groups, we tend to find similarities, or we find things that are shared amongst that group that influences the way that we process the information that we get. Okay, so that's culture and kind of its importance in communication. Next slide. There is an author, a storyteller, really, Mark Turner, who writes, narrative imagining story is the fundamental instrument of thought. Rational capacities depend on it. It's our chief means of looking into the future, or predicting, of planning, and of explaining. In simpler terms, it is what helps us to make sense of the world and to calculate our risks, right? So as we move about the world and decide how and make decisions, right? The stories that we have collected along the way is what we refer back to in terms of determining, is this a good decision or not? Next slide. So they help us to, in essence, connect, navigate, but also to influence the world around us. And I like to go way back because this really is how far and deeply seated this notion is as it relates to human beings. Stories were used during tribal cultures for 40,000 years. And they've been used to preserve history, cultural tradition, to share life-saving lessons like don't go into the jungle at night, the lion will eat you, to reinforce cultural identity, community value, but really most important in this context, behavioral norms. Stories have always been used to encode beliefs, values, practices, and cultural markers into the fabric of a tribal identity. So when I say, and just to clarify, when I say cultural markers are those things externally about us, or things that we put out into the world that indicate to someone, hey, you're part of my tribe, right? So it could be language, it could be sound, it could be dress, it could be image, whatever it might be. But all of that goes back to these stories that we collect along the way in our community, and from people that we deem as trusted messengers: the shaman, the medicine woman, the artist, the storyteller. Next slide. What I want to help you understand as community health workers, a discipline rooted in science, is that there's a science as to why this storytelling actually works, right? So these are kind of the key things that scientists have been able to identify as what makes storytelling so impactful. The mirroring, right? So to connect, to have a shared human experience. We found that when people, let's say, are at the Beyonce Renaissance tour together, their brain waves are actually going to start to mirror each other, right? So there's kind of this harmony that happens when you bring people into a shared experience that they're engaging in. Neural coupling helps us really to imagine oneself in a scenario. That's important because you can tell me a story all day long and how dangerous this is. But if I say, I never go out at night, so this will never be relevant to me, I will not get eaten by the lion, then it's not going to matter, right? Cortical activity, that's really about stimulating cognition. So the cortical activity, when you tell these stories, when you use certain storytelling devices, such as what we call hooks or climaxes, what they do is they stimulate like the release actually of cortisol and kind of stress you out just a tiny bit. But what it does is it makes you sit up and actually pay attention, right? And so if you think about going to this Star Wars movie or whatever movie in the theater, when you're sitting up on your seat, right? That's the impact of cortical activity. Oxytocin, that helps to establish the rapport. There are all devices for this, and I'm going to share that with you toward the end. And connect with the person who's telling the story. It also helps you to have empathy for the hero of the story. We talked about the cortisol, and then the dopamine. That helps us to really experience kind of that intense emotion, and it helps us to remember more. So when we've created this conflict that stimulates that cortisol, right? But then we come back around and we solve that conflict with some moral of the story, well, then there's dopamine that released and gives us all that feel-good moment of, wow, he actually didn't die, right? He survived the lion. Next slide. Okay, so let's talk for a second about cultural narratives. Fancy terminology, but really a narrative is a story. A cultural narrative is a cultural story, meaning is a story that is endemic to, created by, shared amongst a particular cultural group, right? Everyday people use cultural narratives all day long. You probably just weren't calling them cultural narratives if you hadn't already known, right? They use them for sense making, to make sense, as I've said a million times. They're used to indicate tribal affiliation, to say, hey, you and I, we share some things in common, right? And then to influence particular beliefs, attitudes, or actions. So the rub here is that cultural narratives they're double-edged swords, right? So they can be used for good, or they can be used actually for harm, right? Sometimes cultural narratives that were good when a particular group existed in one state, let's say, and used for survival, well, then those cultural narratives might be outgrown and then become damaging or harmful, because who wants to live in survival state all the time, right? So the strong Black woman is the one that I like to refer to as the cultural narrative that for years and years we held on to and we're proud of, but now we see as being rejected wholeheartedly by many people because it's killing us, right? We're doing too much. We're sacrificing ourselves and our lives when we really may not have to, right? Then there's the notion of narrative fallacy. Cultural narratives, those that are incorrect or those that are not seated in the truth, that's what we use that term for. It's about the falsehood in a particular narrative. And that is what we are most concerned about, because that narrative fallacy is actually what's going to give us an entry point into changing a belief or a behavior. Next slide. So in the context of social change, there are really three types of cultural narratives that we are most concerned with. There's the ideological narratives. Those are like political narratives, right? So they promote an ideology or a worldview, defend a position or an action, or help people to mobilize around an issue, right? Make America Great Again is a cultural narrative with all kinds of things associated with it. Not putting any stakes in the ground about it, but it is a cultural narrative. Then there are the community narratives. Community narratives tend to be used to elevate the story of a particular geographic area. They're used to help document the truth of why things are the way they are. It's not just about, let's say, the disparities that we see or the inequities that we see. What are the structural drivers? What's the structural violence that is actually creating the conditions that cause these disparities and these inequities, right? So we use those to tell those stories. And then finally, there's the personal narrative. Some people might refer easily to a patient diary, testimony, a PSA. These are all kind of the sharing of an individual person's story. And those tend to be the most impactful. So community narratives that actually feature, let's say, multiple personal narratives tend to be the most impactful, where we're trying to mobilize a particular community around an issue or lobby for policy change. Next slide. Okay, so let's get into how to actually identify these narratives that we need to address or correct. And in the context, I'm going to use COVID-19 for this training, but I want to really reiterate that these principles can be used for anything, really. Really, it's all about kind of understanding what needs to change and how to bring in the tools of storytelling to do that. All right, so we think about vaccine hesitancy when we think about the doubt and the distrust that I alluded to earlier. Really, all of those doubts fall under kind of three key areas, and we've done a ton of data analysis for this. One is institutions, so that can be the government, it can be the healthcare system, it can be the pharma industrial complex, word I picked up in social listening. Then there's the vaccine science. So we all know there's a lot of skepticism around how quickly the vaccine was developed. People had no idea that they've been researching RNA vaccines for 30 years. And so a lot of that was just buried, right? And so people thought, okay, I'm not going to, vaccines take forever to develop. I'm not going to trust this one. And then finally, there's the information at hand. And this was largely driven by the infodemic and created what we like to call information mayhem. So much information, so much of it conflicting. I either just checked out or I chose to believe what was most accessible or what I saw most often, right? Or what I heard most often in my community. And unfortunately, a lot of times those were false narratives or conspiracy theories. So I'm going to get into some of those conspiracy theories now. Next slide. All right, so when we did all of that social listening and we actually looked at the results of multiple quantitative studies, social listening, the whole nine, we boiled all of this down to about 10 narratives that we call them vax hesitancy narratives that were driving or that covered the reasons people gave for not getting vaccinated. They're listed here in the order of in the order of hesitancy. So highest hesitancy is number 1, least hesitancy is number 10. And as you can see, they have similarities, but there are a number of different barriers, unique individual barriers that live within these narratives. Because remember, the story is it's the whole context of the barrier, right? So it's about freedom from government control. Well, some people would talk about, I'm not getting vaccinated because, I have body autonomy, right? Others would say, I'm not getting vaccinated because you're trying to impose it upon me as an employer, and that's beyond, your right as an employer. So there were different individual reasons and instances as to why people did not want to get vaccinated that would ladder up to each of these. Next slide. Now, the important piece for community health workers, ambassadors, allies, and advocates who are working with communities of color is to understand that the incidence is not the same once we put on the cultural filter. So again, this is where that cultural lens comes in, how we see things, right? Or the socio-cultural context, the history. Why I don't trust the vaccine as an African-American from Tougaloo, Mississippi may not be the same reason why I don't trust the vaccine as an African-American from Boston, right? They could be very different reasons. And so we have to account for that. And dive even deeper. So we use a multitude of methodologies in order to do so. Next slide. Once we've identified these narratives, well, now we're going to employ what we call the counter-narrative approach to cultural engagement. And cultural engagement is really just using communication tools, using communication methods with a very deliberate layer of culture woven in. Okay, it means we've done a ton of work to look at the whole person. We looked at why you tell us you don't want to get vaccinated. We look at your geography. We look at your social network. We look at, are you a parent? We look at what is your socioeconomic status? All these things that go into influencing your perspective, but also your influences. So, and then we begin to craft the story and determine who should share that story, right? Okay, so we start with identifying the vax hesitancy narrative. Then we create a general message that's usually factual information that targets the falsehood in the narrative, okay? We then take a counter-narrative strategy and layer that on top of the general message. And I'll show you kind of very quickly toward the end what that means. But again, we have a ton of resources that can help you understand in depth what a counter-narrative strategy is. But it is an approach that uses a device such as logic, humor, ratios, risk taking kind of, what's the word I'm looking for? And I'm losing it, so I have to come back to that. But either way, there are different ways of kind of getting at the falsehood, addressing the falsehood that causes a person to stop and to actually think, right? Am I buying into this blindly? And then finally, there's the counter narrative, which is the content, right? That's actually what we put out into the world to address the narrative. Okay, next slide. Okay, so background in terms of how we get to what is kind of the issue that we need to correct as a barrier to vaccination. And now I'll take you super high level and fast through how to use some of those storytelling devices to actually create content that is more meaningful, or to have conversations that are more meaningful, because these devices are rooted in science. So next slide. So step one, we want to identify the false narrative. Just took you through that, right? So we actually have something called a vaccine hesitancy grid that's available on our site. It is like a map. It's an index of all of the barriers that we've been able to document across the last 2.5 to 3 years. And we've collected them and aligned them with the actual narrative that you saw, those 10 narratives. And then we tell you which counter narrative approach to actually use. So you're going to identify the false narrative. Next slide. Then you want to consider the cultural context, right? Because remember, even though a narrative might sound the same on the surface, the background could be very different. And that's really what's driving the hesitancy, right? Is it distrust in the government? Is it distrust in this non-culturally congruent provider? Like, what is the context, current and historical? Next slide. Then we want to soften the message, right? We want to, in advertising, we say we got to prime the audience, right? A host will come out and make a joke to get a meeting started. That's all softening. It's called an opener. And we use that, we soften the audience through usually cultural markers, or, framing questions or phrases that really drive the audience to reconsider the basis, the background, the source, or the fundamental premise of this held belief. So you may or may not be able to see this too well. I don't know how big it is on your screen, or depending upon how your screen is. But a good example of an opener, you did your own research, because a lot of you might be aware that a lot of people, that was a cultural narrative, do your own research, right? So you did your own research, but did you pop the filter bubble? Well, if I haven't heard of the filter bubble, my next question is, well, what's the filter bubble? So that's just going to pique my interest and maybe make me more curious in going a little bit further into your content, right? Around the 4th of July, though, we know a lot of y'all have been with family, friends at the cookout. So we use the softener. What did you bring home from the cookout? More than mac and cheese and ribs on that plate, right? Because we all know we're going to bring home a plate from the cookout, but we want to make sure that we're not bringing home COVID with us. So instead of just leaning into, hey, get vaccinated, we want to create a conversation with people, right? And we want to open that conversation in a way that feels meaningful and says, you know who I am and I can relate to you. Next slide. Wanted to reiterate this point. So the purpose of a story is not to tell you how to think, but to give you questions to think upon. So the opener can help you to achieve that, but so can this next device, which we call the hook. Next slide. So the hook, these are those things that I was struggling to grasp earlier, but analogy, right? Facts and statistics, a metaphor or a simile, a paradox, humor, these are all devices used to create hooks. So an example, let's say facts and statistics. We don't just tell you 5,000 people died from COVID last week. No. Again, we're not trying to hit you over the head with the bad news per se. We're trying to give you information that can help you make an educated decision, right? That's what we just said on that previous slide. So we position it. Let's say traffic fatalities, right? Versus COVID-19 deaths, which is more dangerous, right? So we try to put things into a frame that's meaningful. Some of you, if you're hip hop fans, you may know about Versus, the hip hop battle that evolved into R&B as well. So at that time, this was super popular at the time that we were creating this content. So we thought, hey, let's co-opt that image. Let's use that as a hook or an opener, right? It kind of grabs the person pretty quickly. And then we can kind of position the this versus the that within a cultural context. Next slide.
3 minutes, Gail.
Okay, great. So we're almost done. Cultural markers. Those can be language, as I said, in Instagram, TikTok, those types of platforms. Music is hugely effective because it helps the algorithm notice, particularly if you use trending songs. But these are all things that will pull somebody in very quickly. In this instance, we had a counter approach or strategy called Vax Facts. The first slide of that carousel post was "We full, Grady Hospital." This was when we were really at, critical point in terms of beds in our hospitals. And if you're from Atlanta, you grew here and didn't flew here, then We full will resonate with you. So this is how we kind of lean into that local culture. And then lastly, next slide, call to action. After you've pulled them in, you've told them, I know who you are, you've used language that's accessible, you've given them cultural markers that really leans deep into deep culture, meaning my interests, my aspirations, what keeps me up at night. Well, then you got to tell them, now what do you want me to do about it? And that's that call to action. Is it get involved? Is it backs up? What might it be? And oftentimes we use hashtags to reinforce that as well. Lastly, these last slides I'm not going to go into because I'm pretty much out of time. But this is where we line up those devices that I just went through with that neural processing that shows you how those devices actually drive that storytelling impact. And then slide 59 is going to give you an example of content that was created or how we leverage content from those influencers within our approach to drive vaccine confidence. Okay. So I know that this was a ton of information, way too much in this short period of time, but we really just wanted to wet your whistle, as we say, or pique your interest. And hopefully you'll follow up and ask many questions. Slide 60 does give you just a little bit of baseline knowledge, but I think you guys are on social media enough to kind of know these core principles in terms of the platforms and best practices. So to that point, I will turn it over to, is it you, Gail, or Amy?
Great.
And
just wanted to allow you, Gail B, also to give a little bit of a plug for your resources on Alive and in Color, which we can definitely share with everybody after the fact as well.
Thank you, Amy. I really was trying to be gracious and not too greedy with this time. But so the last 3 slides here show you resources that we've got on Alive and in Color, which is our community engagement hub. There's a front end that's accessible to everyone. We've got a ton of content there that's helpful. But if you register to become a member, you're able to create a profile, search for other people who, based on their interest, the issue that they want to address, their geography, that kind of a thing. Next slide. You have access to the COVID Vax training library. That's actually on the front end, so you won't need to register for that. But there are additional resources such as the toolkits on the back end if you register, and that links to this, the tools and resources. So there's an entire gallery, a searchable asset gallery on the back end with everything from webinars, PSA, social media posts, the whole 9, and it's searchable by topic. Lastly, these are templates. Just thank you, Amy. These are templates leveraging our counter narrative approaches where you can kind of create your own social post based on the issue you want to address. All right.
Thank you so much, Gail B. We're just going to take a brief breather, ingest all the information. Appreciate it. Thank you so much. And yes, as Gail B was saying earlier, we will be happy to share these slides and links to resources, information, what have you, after the fact. So now that we've really learned a lot about the online narratives of misinformation and how to address them, one thing that Gil McCrae also raised to me, especially you all working as CHWs, some within healthcare organizations, some within the government, one thing to be careful about might also be employer social media policies, especially if you're considering if and how to use social media in your capacity as a CHW. So I'm not going to actually let you know what your actual employer policy is because you come from so many different organizations and I can't really check up into all of that. But just a brief pointer, some brief pointers into what you should look out for and take care about. I will also say I'm not a legally trained person, so all of these things, if you really do have deeper questions, should probably be looked into in more detail. So some top of mind things to be careful of are whether you're posting in an official or personal capacity, whether you're using your personal social media account or an official account, or even if you are using your personal account, whether you seem to be speaking as an employee of such and such organization. For government employees in particular, whether you're a federal employee or federal funded, which probably does cover a lot of people working in public health, you also want to be careful about things that might be perceived as political activity. And this applies also to social media. So whether you are, while you're on the job, liking a post from someone who is running from office, something like that, for example, could be perceived as political activity. That actually applies to me as well as a Georgia Tech employee, I think, if not this in particular, something related. And then for folks working in health in particular, if you're part of a HIPAA covered entity, remember that that also applies to social media as well. Not just if you're posting in an official capacity, but even more so, honestly, if you're posting personally, to really be careful when it comes to protecting our patients and community members' health information. And that might include, for example, posting an identifiable picture of somebody who might be associated with receiving services from your organization. Just to give a few examples, I looked up quickly online and I could find Morehouse School of Medicine's policies and procedures around social media. And just as one example of a state government employees, I found like the Digital Services of Georgia internal policy. But all to say, all of these details are probably worth either looking up online or asking your employer if you do have particular questions that you're concerned about. Most of the policies are going to address what you can and can't do as an employee on employee time, but all the same, might be worth checking out. One thing that of course has been in the news recently-ish have been restrictions around TikTok as an app, which is ultimately a Chinese app. And for various reasons, our government today has concerns about information technologies and data that may or may not be related or have some regulation from the Chinese government. So at the federal level, TikTok is not allowed on government-owned devices as of December 2022. And that's the same for Georgia state-owned devices. That applies to TikTok, WeChat, or Telegram. Just to know that this really does only apply to state-owned devices. You on your own free time on your own device can use all of these things. WeChat in particular is really popular among the Chinese community, so I got my family WeChat group going still. And exceptions include law enforcement and research. So for example, myself as a researcher at Georgia Tech, despite being a state employee, I and my advisor could apply for special permission to do research using these platforms if we were so inclined. But just to note that it does seem like this is a sort of politically sensitive and shifting landscape constantly. So just stay up to date on information around if and how these restrictions might change. And finally, there's also just online risks that you should take care of yourself, whether you're using social media as a CHW or just in general. Many of these platforms do have digital privacy risks around possible exposure of your own personal information online, especially if you are going to be going after misinformation online. There is the risk of online harassment, which I hope none of you have dealt with too much, but there is nonetheless that risk. If you are posting in a somewhat professional capacity, I suppose there is also considerations of your personal image if your employer is going to look you up on Twitter and see what you posted before. And finally, when we're dealing especially with mis and disinformation and other just not pleasant content online, for your own sake, I think it's worth remembering that it might be not very great to our mental health to just be constantly looking at this sort of dangerous content online. So just to be aware of that and take care of ourselves as well. Finally, Gail B was talking about the amazing work that the Black Cross does. I wanted to also introduce the work that I'm trying to do as a PhD researcher at Georgia Tech right now. And some of the work that we're trying to do is to develop digital tools and strategies to support you all as CHWs in your communities to really try and leverage social media and perhaps other tools that could support you in that. So for example, Gail B mentioned that the Black Cross does really rigorous social listening online to try and understand and find all the different narratives that are around, in her case that she presented today, COVID-19. Now, obviously, as CHWs or other folks working in the public health space, you all are really busy with other things, and that is a super resource intensive and difficult thing to do. That being said, I think one thing that we have been exploring is whether or not there's a way to support you all doing some sort of light touch social listening. Let's say like for looking on what's being talked about online this week on accounts that might be relevant in particular to your communities. And looking into whether there's a way to develop things to help you do that, and also connect that same information that you might be seeing to a hub of trusted resources from, again, various organizations and partners within our own communities that we want to go to first. So I won't share it in detail today, but we have, at least as a first step, developed a social media monitoring outreach dashboard that really is a work in progress from both an implementation and research perspective. And again, just to throw some other ideas out there, some other things that I've been thinking about might include, for example, tools that might help you try and identify like what quote unquote filter bubbles are out there that are relevant to your communities, tools that can help you also analyze the language of the content that you're seeing without you needing to be a natural language processing expert yourself, ways of brainstorming and templating content. I think many of us have heard of ChatGPT. For example, we don't need to get that fancy. And I think there are critiques also of ChatGPT's work, but nonetheless, are there ways that we can support you all in trying to create content and communications in a way that can leverage the research that's out there and also respect your time and cultural knowledge as CHWs in your own community. But all to say, these right now are really just ideas. And I think one thing that I'd be really interested in doing beyond the session today even is to see if some of y'all might be interested in diving deeper along these lines and perhaps starting with focus group discussions as well as some co-design related activities. Think and work more deeply around potential, again, digital tools and just thinking openly about strategies that you all might be interested in. So just to close, I think we're a little bit short on time, but while we are here, if anyone wants to put in the chat or reach out afterwards, if you all have any questions, thoughts, comments to share with us, with each other about social media and CHWs and public health more broadly.
I wanted to know if there's enough time for Gail to respond to Adrian's question, or if that's a longer response.
It's a much longer, it's actually a whole clinic, but I'd be happy to forward resources that we have. And as I mentioned, there's additional resources on the site as well that go into that.
I think it's a really important question. So there's a number of people on this call who utilize social media and who use it in community work. And so we would like to build on your experiences and make social media work for the community health worker workforce. I think it's an opportunity. I have not seen it anywhere across the country where there's a concentrated, focused effort to utilize social media on the part of CHWs. And I see it as an opportunity for Georgia CHWs to co-create dashboards and other resources that might be useful for you. So focus groups, conversations, we would love to have your participation, full participation going forward with anything to do with social media. And now we can also have, this is Social Media 101. And so some of those questions, like what Adrian asked, we could certainly have another workshop that focuses on particular questions that you might have or issues. So we're fully prepared, I think, to do that.
I just wanted to add that we actually did do a specific module with Amy and Georgia, the Georgia Peach program, we called it a content collab. And that would answer, I think, every question that you would have, Adrian, regarding kind of maximizing, the posts, getting the most from the posts, but it is dedicated to teaching you more about the platforms and more about kind of the details of, creating the post. We get into Canva, which is, a social media app that is extremely helpful for creating content that's almost, professionally designed. So hopefully we'll get there.
I think we should look at getting that scheduled real soon. Please complete the evaluation form, please, before you jump off. And there is a form for you to put your name and today's title of the webinar on that form and keep it for your files. Any final comments or questions?
This is Frank. I tried to log into the Peach iPad Georgia Tech site. What's the password for Morehouse School of Medicine or any of the organizations?
Sure, let me put that in the chat. I will note that right now we're dealing with a few bugs that are partly related to the different platforms changing of their own policies of how they share content with us and then how we present it in turn, but I will drop that in the chat. Thank you.
Thank you.
Well, I would just like to say thank you to the 36 people who hung in there from 9 a.m. to 10:23. I appreciate you tremendously.
Absolutely.
Yeah, thank you so much. It was really useful information, and I'm really interested in following up with you. Especially, we're trying to develop the Georgia CHW network website, and so I'd like to get some digital advice, digital counseling. Thanks.
Yeah. And, of course, we did try to utilize as a group social media back in, I guess it was March, for our advocacy day for our Community Health Worker Awareness Day at the Capitol. And we could have done a much better job, but we will going forward. So thank you, everyone. Thankful Thursday. Enjoy the rest of your day and your first week in August. Stay healthy, stay hydrated, and we will see you on the other side.
Yeah,
Have a
and
great
we'll
vacation, Gail B.
My
And we'll
pleasure.
share with-
Thank you.
Yeah, and I think we have everybody's emails from registration, so we'll definitely share out links to these slides, recordings, and all the other links that were shared here today.
Take care.
Thank you. Bye-bye.
Okay.
Yeah, Gail, do you want to just hang on after? Let me stop.
Sure. Just saw the
recording.
notes. Mhm.
Stop recording. Stop